The most important advice is open up. Seek support. Do not isolate yourself. That's the worst thing in the world on top of what you're dealing with. There are other people out there dealing with it. You don't necessarily see them right off the bat, but they're there. So take advantage of organizations like OCALI. Take advantage of the groups, your PTA. Take advantage of Special Olympics. There's so many groups out there where people who are dealing with the same issues, and they can be your best friends and your strongest support, even more so than your family. Your family may not understand, but if you find those families that are dealing with it, you will find someone who understands.
Advice that I might give parents that just received a diagnosis of autism is to get involved and to rely on the professionals that they work with initially. Trust them to stay active and stay involved with their son or daughter's care. It's very important that people don't go home without some tools and activities to get involved in, because otherwise you'll lose time. Early intervention is very important, and we need to make sure that the parents are leading that charge. They're the #1 advocates for their child, and the more they can be engaged, the better outcomes they'll have for their son or daughter.
So if a new parent came to me and they were asking for advice on what to do, I think the first thing I would tell them is try to find out as much as you can. You know, find out what programs are out there, find out more about autism, so that they can be able to see what programs are out there, what services are out there, and also learn a little bit more about what's going on with their child. And then they can decide what would be the best fit for them. Instead of jumping right into one particular type of strategy or program, they can see what else is out there. That was really beneficial for us, was to be able to have an opportunity to try different things and see what worked and what didn't, and we were able to kind of create a program or an approach that worked best for Josh.
Familiar with and already engaged with. Our big important thing for us, I think, on all of the challenges, has been, one, to remember what her strengths are and try to use those to our and to her advantage. And secondly, we have to remind ourselves not to be too surprised when she does learn a new skill. And that, maybe the way we did something before was because she wasn't exhibiting a certain skill. But now when she is exhibiting that certain skill, okay, we can start using that now instead of just using what we were getting by with before.
Well, to the dads, even though it's hard and it's like a punch in the gut, so to speak, your kids need you. You are the anchor, you're the foundation, you're the head of the family. And so your kids need you more now than ever before. So, whether you have one child or whether the child that's diagnosed has siblings, you have to make it a joint effort and you have to be there because they need that fatherly influence in their life.
The advice that I would give to a dad who just got that diagnosis is allow yourself to feel it. Allow yourself to go through the process. Because I've actually done this, that football player, that baseball player, that fishing buddy, that you may not have that now. You may now have to find out what's in that child's world and get into that child's world, as opposed to you pulling this child into a world that you're creating. But allow yourself to feel that, allow yourself to move through that, allow yourself to humble yourself. I've had to let, as a dad, you want to be that protector, and you've got to now step back. You now have to make room for other professionals to come in, and that behavioral pediatrician, that therapist, that occupational therapist, that speech therapist, of course, the wonderful teachers. You got to and now I've had to allow you step back to allow musicians to come in to speak into his life. I've had to live the adage, the old African adage, if it takes a village. You've got to pull back. You can't be that everything. You can't be that super dad to him. You can't be that. So you have to kind of pull back and just let these things occur, but be present, be there, because you're still dad.
Not too many people get this opportunity, and you as a sibling or as a parent, you have such a powerful role to impact change, not only through the life of your child, but other children around them, for people who don't feel that they're strong enough to speak out, to stand up for themselves. So we are advocates, we are siblings, we're parents, we're a family, we're a community.
Well, sometimes I don't care like how they're diagnosed. Sometimes I still want them to keep living their life.